Multiple U.S. states are dealing with a major spike in new cases of COVID-19. Both Florida and Texas are pausing their plans to reopen. And the U.S. Centers for Disease Control, the CDC, now estimates the actual number of infections is likely 10 times higher than the number reported. We get more now from Stephen D'Souza.
Across the country, more than 30 states are seeing a spike in coronavirus cases. And yesterday, the U.S. set a record for most new cases in one day with more than 45,000. Florida is one of the states that is getting hit hard right now with more than 9,000 new cases. But the governor there says it's not as worrisome as it was a few months ago because the majority of people being infected now are young people who are asymptomatic. So he's not going to be taking any drastic measures. In Texas, they are slowing down, they're reopening, and they're actually reversing some earlier measures, shutting down bars and reducing capacity at restaurants. In Houston, ICU beds are getting filled up. As well, the infection rate is 3 times higher than it was earlier this year. But still, the governor of Texas, Greg Abbott, says it's not time yet to shut down.
Now is not the time for stay-at-home policies across the entire board. I believe we can do both. Continue to engage in our economy while slowing the spread. Remember, we did that for months. Texans knew how to slow the spread by doing what we did in March and April and during the course of May.
Yesterday, the White House Coronavirus Task Force held its first briefing in almost 2 months. But Vice President Mike Pence painted a much rosier picture than what the numbers across the country are showing, and he defended the administration's actions in terms of holding rallies and gatherings in some of the states that are seeing spikes. Take a listen to what the Vice President had to say.
Freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And even in a health crisis, the American people don't forfeit our constitutional rights.
Some states are starting to put up travel restrictions. For example, here in New York and New Jersey and Connecticut, anyone coming from these hard-hit states now into this region will have to quarantine for 14 days. Next week is a 4th of July weekend, and in Miami, they're shutting down all the beaches and preventing any public gatherings because they want to control the spread. Stephen D'Souza, CBC News, New York.
Well, for more, we're now joined by Dr. Ashish Jha. He is the director of the Harvard Global Health Institute. He joins us right now in Cambridge, Massachusetts. So, Dr. Jha, thank you for joining us today.
Thanks so much for having me on.
Listen, I want to begin with a broad stroke here, and to that I mean your reaction to seeing this spike of cases in so many states right now. Given the pushback against protection measures in the United States amongst some, was this spike, these spikes, foregone conclusions?
Yeah, so these spikes are unfortunately not a surprise. The nation opened up around Memorial Day at the end of May. And in many, many states, including mostly the states where we're seeing the spikes, they opened up with large number of cases still ongoing. They ignored the White House's own guidelines for when it would be safe to open. And they opened up too aggressively. We opened up bars and restaurants, and in some states, nightclubs opened up. And many of us were very, very concerned that what we would see is exactly what is happening right now. And sure enough, this is now a pretty meaningful, large outbreak in nearly half of the country.
Well, to listen to the Trump administration, in fact, we just heard Mike Pence, the clip from him in Stephen's report, the administration keeps pointing to testing numbers, saying that as testing increases, so will the number of cases. Is there any proof to suggest that these numbers are the cases that always existed, but until recently went undetected?
Yeah, so that's an argument that's been ongoing from the administration now for several weeks. And I do think that the increase in testing is partly responsible, but that's not most of it. Increasing in testing would not lead to large numbers of new patients ending up in the hospital and in the ICU. We have so much evidence that this is largely about increasing number of underlying infections that are occurring in all of these states across the country. So the idea that it's all about increased testing is a distraction and doesn't get to the heart of the issue, which is we're seeing large outbreaks in more than half of the country.
Doctor, I'm wondering if you could help me out with something. As we look at the United States right now, is this still the first wave of the disease that we're looking at in the U.S., or does this resurgence of numbers actually mean that we're in the second phase, second wave already?
You know, the whole idea of waves was that we would get the first sort of infections under control, bring the numbers way down, and then we might have a second wave later. This is not only just the first wave. I am worried that America's mismanagement of this disease is so profound that we may never quite get out of the first wave. We may just stay with water up to our necks for the next year until we get to a vaccine, because it doesn't seem like, at least from a political leadership point of view, that the U.S. government is really interested in trying to bring the disease under control and help the American people and the economy recover.
You know, you say that, and I'm thinking about the early words that we were getting from the U.S. Centers for Disease Control when they were laying out the best case and the worst case scenarios. So if you are saying that you're afraid that essentially the United States is going to be mired in the first wave until a vaccine is found, well, that could be anywhere of a year and a half from now. What does that tell you about the likely scenario for the United States if things don't actually get under control?
Yeah, unfortunately, now I am optimistic that many states in the U.S., as you know, America is a big country, and there are states that are making really good progress. So I actually do want to be very clear. I think there are going to be states in the U.S. that are going to get this virus under control and do a good job. But as a nation, unless we do a serious course correction, we are headed towards, I believe, more than 200,000 deaths by early fall, 300,000 deaths by the winter time. And even then, we won't be done. We will still be many months away from a widely available vaccine. So, we are acting like the pandemic is over. But unfortunately, it is still just in the beginning phases. And I've been imploring our political leaders, especially in Washington, to take it much more seriously.
Well, Dr. Jha, we are watching from this side of the border. Thank you for this. Appreciate the time.
Thank you so much for having me on.
And that's Dr. Ashish Jha, who is the director of Harvard's Global Health Institute.